Hi, my name is Daniel Chang, and I will be doing my demonstration speech on the stethoscope, the blood pressure cuff, and the electrocardiogram. These three tools are used to take a measurement of your heart and how your heart is functioning at that time. So I will be giving you a little introduction for each while explaining the background for each of these three tools so you can understand more and learn something new about them. So let's begin with a little background information on how blood moves throughout the heart. So first, the blood comes through the superior and inferior vena cavas, as well as the pulmonary veins from your lungs. So it comes with deoxygenated blood on the right side and oxygenated blood on the left side. And it goes through the two atrias first, and then the tricuspid valves and the mitral valves open up for it to move into the two ventricles. And once these valves closes, that's when you can hear the lub sound of the heart in which it contracts. And once these ventricles are filled with blood and it creates pressure in these ventricles for the pulmonary and aortic valves to open up and get released back into the lungs and entire bodies. So that is when the heart relaxes and you hear the dub sound of your heart. And to demonstrate this, we will be using a stethoscope. And the stethoscope has two ends. So we first have these two earpieces in which we will put into our left and right ear in order to hear the heart. And then on the other end of that is the bell. And the bell will be placed on your chest where your heart is, and you would place it at the herbs point in order to perfectly hear the contraction and relaxation of your heart. So when the mitral and tricuspid valves close, that is when you hear the lub sound, or and when the pulmonary and aortic valve closes, that's when you hear the dub sound. So it will go something like lub dub, lub dub, lub dub, and that using a stethoscope, you can hear that in real time, and that is how you can hear the heart beating. And if there's anything wrong with that sound, like maybe there's a heart murmur or something else, that means that the valves are not correctly closing at the right time, or it's not closing perfectly. And so that is why a stethoscope is very useful to be used with your primary care doctor or someone in the health field to know if your heart is working, because your heart is one of the most important organs in your body. So moving on, we are gonna talk about how to use a blood pressure cuff. So to demonstrate how to use a digital blood pressure cuff, we wrap the cuff around our upper arm, and that is where the brachial artery is located. So that is when the brachial artery will be squeezed by the blood pressure cuff, and using that squeeze is when we can hear the contraction of the heart from the tricuspid and mitral valves closing, as previously mentioned, and that gets the systolic blood pressure of the heart. Next, when the blood pressure relaxes a little bit, that is when we hear the aortic valve and the pulmonary valve close. So that is what we get for the diastolic blood pressure of the heart. And the pulse helps us hear how fast the heart is beating per minute. And usually you want to keep the systolic, diastolic under 120 over 80. Otherwise, anything above it is called elevated blood pressure. And right, if you can see in this number, 143 over 91 means that you are in stage 2 hypertension. And why is that bad? Because hypertension is often called the silent killer because it may show no symptoms, yet it significantly increases the risk of heart disease and stroke, as quoted by the Food and Drug Administration. So over time, if it keeps at this chronic blood pressure, your heart will weaken its muscle, causing a further increased risk of heart problems. You could also hear the systolic and diastolic heart pressure manually using just a blood pressure cuff and a stethoscope on the upper arm area. And this is used when you want to get a more accurate reading on how the brachial artery is being contracted and released. So it helps with knowing more thoroughly and getting an accurate reading. Now let's move on to the electrocardiogram. So the electrocardiogram is used to hear the electrical system, or not hear, but measure the electrical system of your heart. So as you can see, you would attach these electrical nodes like mostly on your heart area, your chest area, and you would attach it two on your wrists and two on your ankles. And you do that so then the electrocardiogram can see the different sides of your heart, because if you just get it on top, that's only one side. So you would get it on the left, right, and up and down. And so therefore, the electrocardiogram will spew out some waves, and you call this the PQRST waves. And this is a normal wave that you'll see. And the P wave shows that the electrical signal is on your SA node, and the QRS wave shows that it moves into the AV node and the bundle of His and branches, and the T wave shows that it moves to the Purkinje fibers, and then it goes back into your SA node at the P wave. So that is how you can measure the electrical signals and waves using an electrocardiogram. And using this electrocardiogram, you can see if there is any problems with the waves, like if the P wave is wrong, then you know that there is something wrong with the SA node, and if the QRS wave is wrong, there's something wrong with the AV node, and it can also tell you what kind of condition your heart is in, and if you are going to be like at risk of a heart attack or a stroke. And therefore this is a very important tool to monitor your heart activity. So thank you for coming to my demonstration. In conclusion, these three tools are very useful to measure your heart and its condition, whether it's being healthy or whether there's going to be long-term risk to it, or whether there's some trouble that's occurring with the heart's electrical system. And in the end, it can tell you a lot about your heart and learning more about its functions. And thank you, and these are my references. And thank you again for coming to my demonstration speech.